The House is voting on the ACA subsidy extensions today, and I was asked by the IDP to give some thoughts in a press conference about how the ACA subsidies and the ACA is impacting rural folks. I recorded what I said, and this is how it went. Thank you for that introduction, Chair Hart. As she said, my name is Dr. Nicole Lowe, and I'm a PhD prepared nurse, co-founder of Women-Centered Health, and a rural woman raising my family in Sheraton, Iowa. Your zip code impacts your health more than your genetic code, and rural areas are worse off. Much of this is because of policy. Rural life is made harder and less healthy simply because of where we live and who represents us. This is known as political determinants of health. Political determinants of health are the laws, policies, and budget decisions that have caused rural people to experience higher maternal mortality rates, more chronic diseases, access to fewer mental health services, longer travel times for care, and to be more susceptible to hospital and clinic closures. The Affordable Care Act is a clear example of a political determinant of health. Its insurance protections, preventive care requirements, and income-based subsidies didn't just reform a system, they made healthcare possible for millions of people, especially rural families, because Medicaid use is higher in rural areas. You may be more familiar with the term social determinants of health, like how housing, transportation, education, and food access impact health. And while that framework was an important step forward because it helped move the conversation away from blaming individuals for their health outcomes, it doesn't go far enough. Social determinants describe what conditions exist without naming why they exist or who has the power to change them. And political determinants of health name the source. They make clear that when your health depends on your zip code or your insurance status, that isn't fate, it's governance. And this is where policymakers come in, not as villains, but as stewards of public health. Every vote, every budget line, every policy decision is an opportunity to make communities healthier or sicker, to reduce harm or allow it to continue, to support rural families or leave them behind. Because let's be clear, folks, people don't stop getting sick when subsidies disappear. They just become uninsured. And rural hospitals, which are already operating on razor thin margins, are paying the price because they have to absorb the cost of uncompensated care, and they simply do not have the bandwidth to do that. This isn't complicated. When people can afford coverage, hospitals get paid, uncompensated care drops, and essential services stay in place for rural folks. And in fact, for many rural counties, the ACA was the difference between a hospital staying open or closing altogether. And as a researcher, I fully understand the intersection of our social world and our health. And as a former candidate who spoke to hundreds, if not thousands of rural Iowans, I know how close so many folks are living on the edge of choosing between healthcare or paying for groceries, their home insurance, or utilities. You would be alarmed at how many folks are living on that edge. And as a nurse, I have literally spoken to patients who are more worried about how they're going to pay their medical bills than the health condition that landed them in the hospital to begin with. And as a rural woman, I know how scary it is to be an expectant mom in rural Iowa and wonder where is the best and safest place to deliver your baby, because OB units are closing at alarming rates across the state. Since 2000, we've had over 34 OB clinic closures, and Lucas County, my county, was one of them. And as a daughter, I've seen the impact the ACA had on the decision between my mom starting her own business or staying in a job that absolutely drained her just for the insurance. Our health outcomes are not accidental. They are governed. Today, our health outcomes will be governed again, and its impact will be felt the hardest in rural communities. And stewardship from our political leaders means recognizing that responsibility. Today's vote isn't about declaring the perfection of the ACA or that subsidies are the solution to our healthcare crisis, because they're not. Today's vote is about if people can make it to Friday, their next paycheck, if they can have heat and healthcare, and if they can even live to pursue happiness and liberty. Thank you for your time.